Hello everyone, this is Meredith Stutz, and once again we have the opportunity to highlight different members of our UC Health family. And today we are highlighting a very special member of the University of Cincinnati Cancer Center, and we are so fortunate to have Dr. Leeya Pinder joining us on today's podcast. Dr. Pinder has quite the introduction, so buckle up and get out the application to be part of our fan club. So here we go. Dr. Pinder is an associate professor at the University of Cincinnati College of Medicine with the Division of Gynecologic Oncology and the Director for Global Center Cancer Control, Obstetrics and Gynecology. Dr. Pinder was also named a Cancer Moonshot Scholar by the National Cancer Institute and supported by the White House's Cancer Moonshot Initiative. She was named one of the 2024 Healthcare Hero awardees by the Cincinnati Business Courier. And hot off the presses, folks, she was just named the 2024 Humanitarianism and Volunteerism Award from the Society of Gynecologic Oncology. Congratulations, by the way, and welcome to Dr. Pinder.
Thank you so much. I really appreciate the opportunity to speak today.
Yes, we appreciate it too. I just got to ask Dr. Pinder, we are recording this on a Wednesday morning.
Yes.
You are very busy. So how is your week going? What are you working on?
Yeah, so this is actually a busy week, only because I'm number one, like I'm a clinician, and so I have lots of patient care things that I do, but I'm also about to leave and go back to Zambia in a week. And so it's really a busy time for me as I'm trying to like organize and get things together so that I can really be like on the ground and hit the ground running when I get to Zambia. So, trying to wrap up patient care, but also just trying to prepare myself to go away again. So yeah, so it's busy, but it's good.
Busy but good. That's
Yes.
something that I want you to notice, listeners, is that Dr. Pinder is many things, but one of the things that she does best is that she is present wherever she is. So while you are here in Cincinnati and at the University of Cincinnati Cancer Center, you are present with your patients, you're present with your research, you are present with your advocacy,
Yes.
and when you are in Zambia, which we'll talk about in just a few minutes, you are ever present.
Yes.
So I want to roll it back just a little bit.
Sure.
Before we hop on a metaphorical plane and hop over to Zambia, I want to talk about you for a little bit. What or who got you interested in the world of medicine and even focusing specifically on women's cancers?
That's a good question. It's interesting. I didn't come from a family of physicians. And for some reason, my godmother asked me when I was 7 what I wanted to be when I grew up, and I just picked being a doctor out of the sky, to be very honest with you. And then I specifically went and I said, I want to be a heart doctor. And so, I just kind of stuck with that. That was something that was in my head and in my heart. And then, of course, as young people, you see things like The Cosby Show, which is, basically, a Black family that, one of the folks is a physician. And so, that was kind of my idea of what a physician looked like. And then when I got to med school, I realized that I did not like the heart at all. I did not like heart physiology. So I ended up switching that, and I was great with my hands. And so I really wanted to do something surgical. And then more specifically looking at cancers, I actually had the opportunity to do what are called AIs. So basically acting internships while you're in medical school. And it really is an opportunity for you to serve as an intern. And I actually had a patient that was a 19-year-old African-American female who was HIV positive, who actually had advanced vulvar cancer. And as I would round on her every day, I would see her pain and I would see her circumstance and her situation and how she was isolated and alone. And for me, looking back at her, I realized that, in any instance, that could have been me. So it just happened that my path was a little bit different. So it's one of those times where like someone is mirroring your life just in a different way. And so I felt like what she was going through and where she was in life, I didn't want that to be anyone else's story, especially if they looked like me. So I decided to go into GYN oncology because of that. And so I kind of tailored my path, even though it was kind of a winding, long road to get to GYN oncology, focused on trying to prevent people from having kind of the circumstances that she did, especially at her age.
Thank you. Yeah. So Dr. Pinder and I first met back in January at the All Hands for UC Health, and that is where I first met her. I heard about the amazing work that she's doing all over the world. And so now we finally get to have this conversation today, which has led us, Dr. Pinder, to your office. And if you're not here right now, I wish you could see it. Every single part of the wall is covered, not only with what makes up Dr. Pinder from her academics and professional standpoint, but also her heart, passion, and focus for people and for women around the world. So I believe that her office is a lab of what is working, what is in the works, and what is a win for you.
Yeah.
So behind me, here
Yeah.
in my chair,
Yes.
is this whiteboard that
Yes.
is color-coded, organized,
color-coded.
but at the very center of this whiteboard, it has the word win on it. So can you tell me about what is a recent win that you have had in your world and why?
Yeah, so in a kind of in a square box, almost in the center with like little asterisks around it, it says food pantry win. And that was really important for me because I see a lot of suffering that happens when you're doing GYN oncology. And adding to that suffering for a lot of people is food insecurity. And so I've had, unfortunately, patients who are concerned about where their next meal is going to come from, concerned about the fact that they're so run down and tired and can't get to grocery stores or can't get to the supermarket. And so they're really kind of struggling trying to make what little food they have at home work. And so that doesn't help with outcomes. And when you look at like research in general about food insecurity and the cancer outcomes, they really do have worse outcomes than those that are more secure and have access to food consistently. And so one of the things that I thought about was, could we actually do a food pantry here and actually provide healthy foods for our patients? And so we partnered with Dean Cummins and Joy from the UC Bearcat Pantry, and they loved the idea and they thought it was a great idea, and they are supporting kind of our start to the food pantry. And so we actually now have a food pantry for the Cancer Center. It originally was just kind of with GYN oncology patients, and now we've made it such that it can be for all patients at the UC Cancer Center. And so we are super excited. The email just kind of went out a couple weeks ago, and so now we actually have the opportunity to provide all of our patients at the Cancer Center with a bag of kind of shelf-stable food, and also give them a gift card so that they can actually go grocery shopping, because a lot of people can't work. And so on my board says food pantry win, and that's because I'm super excited that we actually are able to provide some food support for our patients. And so that's one less thing for them to have to battle with as they're trying to face a cancer diagnosis.
It's one less thing that I may have to think about through the day. But what do you hope, Dr. Pinder, that it's one more thing that they can be reminded of when it comes to partnership, survivorship, and emotional support? Because food isn't just food. It can mean a whole lot more.
It can. And so one of the things that I often tell our patients is that we're actually with you in this journey. And so for me, it's kind of reaching them at every point of their journey. And it really is a way for the Cancer Center to say, hey, we are with you, we see you, we hear you, we know that there are times that things are going to be a struggle for you, but let us support you in those times. And so this is just one point in time, but it really just kind of goes towards the fact that we are supporting them in their entire cancer journey and with every aspect of that care. And so I think it just goes to the heart of who we are as providers, and it really is going to go towards the mission of the UC Cancer Center and servicing our community.
So as you can hear, not only is Dr. Pinder very passionate, but she is a woman who stays busy. Not only here on campus in Cincinnati, but also you spend a significant amount of time in Zambia, which you mentioned earlier.
I do.
So tell us briefly, why Zambia? There are hundreds of countries in the world. Why Zambia?
Yeah. So I'm very fortunate. As a GYN oncologist, to be able to spend the amount of time that I do overseas is actually really remarkable. And so, kudos to my chair, Dr. Michael Thomas, who supports this. And so, I basically spend 4 months overseas every year. And Zambia is important because I actually lived full time in Zambia for 2 years. And how I actually got there was through my mentor, whose name is Dr. Grosbeck Parham, and he's actually a U.S. trained GYN oncologist. And I just happened to be at a conference that he was at, and he was talking about the work that he was doing. And it was actually right at the time that I was trying to transition out of private practice to do more global work and to also go back into GYN oncology. And he did this presentation that spoke about the work that he was doing in cervical cancer prevention and trying to change women's lives in Zambia. And I went up to him afterwards and I told him that he was living the life that I wanted to live. And so he just kind of looked at me, because I'm sure people have said things like that to him, on multiple occasions, but I actually was telling him the truth, because in my heart and in my spirit, like, I knew that was what I was supposed to be doing. And so he's like, okay, fine, here's my email. And so I actually emailed him, and, we stayed in touch. And then I had the opportunity through a Fogarty Fellowship to live full-time in Zambia. And so I lived full-time in Zambia between 2016 and 2018, absolutely fell in love with it, love the people, love the work that we do there. And we're actually like building and creating things there. And so, so Zambia is like a perfect fit for me. I lived in, Kenya as well. And so Kenya, I love the Kenyan people. And I just have living full time in a country kind of just gives you a different perspective. And we had already started work there. And so I just want to kind of continue that work. And again, I work in other countries as well. But my home for this work is in Zambia at the moment. So, yeah.
Thank you. There's also, in addition to your home for much of your work, you were recently awarded a big vehicle to do that work, which is this Moonshot Grant that we want to hear more about. Specifically, what was it about that grant that lit your fire and also felt like equipping of an opportunity to say, like, we need this, and more importantly, women and patients need this?
Yeah. So what's interesting about the Moonshot Scholars program is that they actually wanted to take the opportunity to look at researchers in a different way. And so they wanted to give young early stage investigators from a diverse background and also who did a diverse, had a diverse set of skills and did, research in a diverse way. And so, so this program actually gave us the opportunity to apply for a major R01 grant, and actually, signaled us out as being different, but in a good way, because they knew that we had different ways of thinking and they knew that we touch communities in different ways. And so, so the Moonshot Scholars program actually just gave us the opportunity. And so for me, the project that I chose was really important to me because, again, I work over in Zambia and we did a big kind of randomized clinical trial looking at the way that we treat cervical precancer. And one of the outcomes of that study was really to figure out, or what we found actually was that women living with HIV didn't respond to our treatments as well as women who did not have HIV. And so we've kind of been on this journey now trying to figure out why it is that women living with HIV don't respond as well as we would hope they would to our treatments. And so just trying to find new ways to look at, some of the medications that we used previously, look at the vaginal microbiome, look at, all of these other factors that may contribute to why they're not responding to our treatment as well. And so that's kind of what sparked my idea in terms of what I was going to apply for. And so, so this program or this grant is really important because it, number one, is a novel way to do things. But number two, in a population where women are continuing to die and there's a high level of HIV, there's a high level of cervical cancer, we really have to figure out new ways to do this. And so I'm just trying to figure out like the next step, like what are we going to do? What can we do to really stop women from dying overseas? And we don't talk about cervical cancer a lot here in the US because our numbers are relatively low, depending on what population you're looking at, but they're relatively low. But if you look at women living in low and middle income countries, they make up the majority of the cancer cases and deaths from cervical cancer. And so we really have to do something differently. And so for me, that was really what I wanted to focus on was women living overseas and actually living with or trying to prevent cervical cancer from happening. And so I'm really, really fortunate because I'm the only one in this like GYN oncology space. I'm the only international grant for the Moonshot Scholars program. And so it really is a privilege for me to be able to do this. So I'm super, super excited. And I think it'll make it. Thank you.
Yes. So in case you aren't familiar with the Moonshot Grant Cancer Initiative and really the specs of how big of a deal this is for those of you, including myself, who are still learning. So Dr. Pinder was awarded $2.75 million with an M dollars of funding money for the first 5 years and then additional funding for the final 2 years. So Dr. Pinder, talk to us about the timeline for this project and ultimately, how's it going so far?
Yeah. There are always struggles when it comes to projects, but so things are going well. So we're actually doing this kind of beginning phase where we're starting to kind of talk about behavioral factors. So looking at the environment, look at social factors, look at, again, kind of behaviors or things that women are doing. So we're doing a lot of survey work for women who are coming in already for cervical cancer screening. And then after that particular phase, then we'll start to, as part of that phase as well, we're kind of looking at kind of perception of what it looks like to use this particular medication, because really what we're doing is repurposing an old antiretroviral medication that was previously used for HIV. So we're actually using an older medication, just changing it, but women have to use it in a particular way, so actually insert it vaginally. And so we really have to talk to women about how they feel about inserting a medication, vaginally, and for how long it's going to be in there and all these things. So we're trying to tease out all of those factors, and then we'll actually roll out the intervention. And so in the first 1.5 years years or so, almost 2 years, we'll work on the behavioral stuff, and then we'll tailor our intervention so that we can make sure that it's appropriate for the context. And that's really, really important. And then we'll have a good like 2 to 3 years of working on that, and then we'll come up with our data and our next plan of action. So right now things are going well. They're, moving along, but they're really well. We have a fantastic research platform in Zambia, which makes my life easier. So we have a dedicated crew of nurses, we have dedicated research assistants, we have dedicated community advisors and navigators and, health workers. And I'm fortunate, again, my mentor is kind of supporting some of this work. And so we just have a really outstanding research platform. And, also UC, and, I'm not sure if we don't usually talk a lot about this, but UC actually has a research and training alliance. And so an institution that's focused on research and training that we created last year in Zambia. So that platform kind of houses our research platform. And so we're able to do a lot of work through that as well. So
care, education, and research are a part of our tripartite missions here at UC Health. And in a way, this project is bringing all three of those into one.
It does.
For you, I wanted to ask, when you're in Zambia, because this isn't just a research grant, a cancer grant that you got, and you say, okay, someone else go do that. No, you're the one who is in Zambia. You're the one who has relationships with patients. And you've already been to Zambia this year in 2024. Tell us and share with us a little bit, Dr. Pinder, about those conversations and relationships that you're building with patients that you think would be helpful for us to understand what you're learning and what we can learn about the realities that women are facing in different parts of the world that we ultimately can understand and relate to because we're all people.
Yeah.
So what is that? What is this project teaching you?
Yeah. So I actually think that some of the things that I've learned kind of over the years, and a lot of it comes from the partners that we actually have on the ground. So we're actually really fortunate in that we've been able to train GYN oncologists in country, and so we've also, again, my mentor has partnered with, some of our, local colleagues there, and it's been going on for years. And so I learn a lot from them because I can actually see and feel their frustrations and their heartaches and their devastation from continually seeing the same things over and over again. So the concern is always that we aren't catching women ahead of time. We're always catching women in late stage disease. And so we have to, I often talk about status quo. We have to shift and change the status quo so that we can actually save lives. And so, for me, I learn every day how fortunate we are to be here. And I learn every day when I'm there how much harder I need to work to change this process, but I can't do it alone. And so then I partner, that it's really important and critical to partner with my local colleagues again. And then for me, it's just an opportunity also to just give of myself and just kind of forming relationships with people and letting them know that we see you, we hear you, we want to do better for you. And so I think every day I kind of learn those things and kind of look at those things as I'm there. We have a lot of work to do. And I think some of it goes towards what happens here as well. And when we talk about women living in poverty, and how poverty impacts your ability to, seek access, how it impacts your ability to navigate the care and the treatment that you get, how it impacts your connection with your providers who live a very different life than you live. So I think just kind of recognizing that everyone's life matters no matter where you live is really important. And so if people learn nothing from this, just know that there are things that are outside your bubble, right? There are people who live outside of your town, your city, your state, and definitely outside of the country who have struggles. And, if you can do anything in your power to change the narrative for someone or change the narrative about someone, that would be important for you to do. So I oftentimes try to be an advocate and change the narrative and change the views and change the thoughts of people so that they recognize that, these are, women, they are mothers, they're daughters, they're, people's children, their wives, they're the same people, that are here. They just live in a different circumstance and for no fault of their own. Right? They just happen to be born in these other countries. So anyway, so that's what I, kind of hopefully answered your question. I'm going to take away from, from all the work that I do there. Yeah.
In addition to the compassionate care you give, what would you say, Dr. Pinder, is your goal? When you walk away or that final amount of research monies is given for your final plane ride back home to the United States, at least for now, what do you hope? What do you want to hang your hat on?
Yeah. So when I was living there full time, I was really, really frustrated because a young woman, who I thought shouldn't have died because the system basically failed her. And I said to one of my residents at the time, I was like fussing about the fact that this woman, had just died and we failed her. And he was like, it just happens. Like that was his response, is that it just happens. And from that point, like I hung a sign that says it just happens, right? Like in my office, because it doesn't just happen, right? Like it's a series of events, a series of circumstances, a series of things that actually results in a woman dying from a preventable disease. And so my ultimate goal is to not have that be the statement that people make, right? That it just happens. That people actually, are living when they're supposed to live, that they're not coming in with advanced disease. And so it's really about kind of the on the ground, kind of changing the narrative and the focus of like our providers and our trainees, and also trying to create interventions that actually are going to save lives. So I walk around and I say things like, I'm going to change the world, right? And people think, people are just like, okay, everybody says that. But no, I actually do want to make a difference, right? Like I want to stop one more person from dying that doesn't have to die. And so that's really kind of what my goal is. And then also that, people feel loved and cared for and like they actually matter. And so that's really, kind of what at the end I want people to live that should live, and be able to make an impact in that way. Yeah.
What do you feel is the difference for you being able to work on this project, be supported in this project, because you work, live, and are here at the University of Cincinnati Cancer Center? What is that difference? Yeah. And ultimately, what's the difference for you, and what's the difference for your patients?
So actually I always say that I'm very fortunate because it's really unusual for a GYN oncologist to be able to go overseas like this. And so I also felt like I have really from a research space kind of a blank canvas. So I was just basically given this blank slate and say, we know what you do. We know what you can do, so just do it, right? So it's a little bit of kind of freedom and confidence and support from the UC community, and they back what I do and my crazy ideas and all the things in my head. They actually are really very supportive of that. And so again, like speaking towards my chair and towards the dean's office and the College of Medicine, like they've really been champions and advocates for the work that I do. And so it has been incredibly gratifying to be in a space where I'm so supported. And again, I have the space and the liberty and the freedom to make the changes and the difference that I want to make in the world. And so, so it has been, just remarkable actually being here, and having this kind of like blank canvas by which to do my work. And so it's been great from that regard. Yeah.
We'll get to shout-outs in a minute, because I know you certainly want to give a shout-out. But speaking of our coworkers here at the University of Cincinnati Cancer Center and UC Health, is there anything you want them to know about your project that maybe they see you coming in and out, or like, oh, she's here today? Or like, how's that going? Is there something that you would like to just take a minute and be like, if you're wondering about this, let me give you a little insight.
Yeah. So, I think I work in kind of two different spaces. So I work in like the global space, but I also am super kind of working in this community space, right? Because my goal here is to also stop women from dying, right? Unnecessarily. So, for me, there are big things in, cancer prevention space. So, most of the time people are like, okay, well, GYN oncologists, shouldn't be thinking about like the minor thing or more minor things like, cervical pre-cancer, right? Because we deal with cancer. But it really is kind of like a continuum. And I'm also a public health provider, right? So I look at things in a global scale. So if I can prevent women from coming to see me with actual cervical cancer, then I'm going to do that. And so for me, what I'm working on right now that people I might know a little bit about is I'm really just trying to increase access to cervical cancer screening in our community. And so if I can find all these touch points where people aren't coming in to figure out how we can meet them where they are, so that we can actually get them screened and get them service and get them linked to care, that is what I'm trying to do. So when you see me like running around asking for different things and asking your opinions on different things, this is what I'm doing. I'm trying to like create a system and a space for our healthcare system by which women are being touched at different points, kind of in their lives or where they are. We're just meeting them where they are so they can actually get screened and actually get linked to care, right? So that's what I'm doing. So when you see me running around most of the time, that's what it is. Or I'm trying to figure out like how I can support my patient in some other social aspect that's going on. So yeah.
Dr. Pinder, what are you learning right now? What's something that for you might cultivate the reaction of, I had no idea, or like, no way. For you, what is that?
Within medicine or just within like everyday life? What am I learning?
It can be related to medicine. It can be related to the project. It can be related to this
this giant board
whiteboard of ideas and grants and countries you plan to take your work to.
I am actually, the newer thing I'm trying to figure out or kind of work in the space of is looking at how like our metabolites, or kind of the metals or the things in our body, how they relate to like cervical cancer and prevention. I'm a cervical cancer person. So I'm trying to figure out like new avenues, still trying to answer that question of like why our treatments aren't working as well in certain populations. So part of what I'm looking at right now is just looking at different elements in our blood and in our, like in our vaginal, mucosa or microenvironment to figure out if any of that relates to cervical cancer. So I don't know if people will be blown away by that because I'm pretty consistent about what I focus on, but that's what I'm doing. Yeah.
I think it's cool because if you're excited about that, we know that it has a hope.
Yes.
Someone's got to be excited about something. If you're excited about that could save people's lives.
I am. Yeah. And also just trying to figure out ways to make things easier for us, right? We all have so many competing priorities in our lives, whether or not it's family or work or, social commitments, that we really just have to figure out easier ways in order to encourage women to get screened or encourage women to come in or, just general health and, I always think we just need to do things a little bit differently. So,
who would you like to give a shout out to?
I definitely want to give a shout out to my program manager who keeps me sane. So Cynthia Spikes joined me in September, and she has been super excited about the mission. And it's always really, really refreshing when you have someone who shares your vision and sees your vision and sees what you're going to do. So she actually, I tell people all the time, she keeps me sane. So I really, I could not do what I do without her. So Cynthia Spikes is fantastic. My chair is super supportive. He recruited me and he had this vision of global health work, and he had this vision of my research work. And so he's been super supportive. And then my partners have they cover me when I'm away, right? I can't do what I do without them covering me and taking excellent care of my patients. And so those are my shout outs, professionally. And then of course, the College of Medicine and all my support there. And then my family, right, just gives me the space, and my friends, they ground me and they give me the space. Like I said, they're super supportive, and they've been that way for years. And so I also could not be who I am without the love and support of family and friends. So
on that, right now in our world of UC Health, the University of Cincinnati Cancer Center, we are asking people to share their 6-word story of hope. Essentially what we're asking people is, why do you do what you do? Mm-hmm. What is your why? In only 6 words.
6 words.
So Dr. Pinder, take a minute if you need to, but what is your 6-word story? And yes, we do encourage counting words on your fingers.
Okay.
Go ahead.
Eliminating the status quo saves lives.
Beautiful. Thank you. That's great. Final question is, what advice would you give to people who are in this world of women's health, women's cancers, or they might be listening to this and saying, I want to be Dr. Pinder one day. What advice would you give them?
Don't accept no as an answer. If someone tells you no and you truly believe that it's the right thing, try to find ways around that no. Be authentic in everything that you do and stay true to who you are. And people will see that authenticity and they'll support it. Find yourself some mentors, because mentorship is really important. I had to do a lot of things on my own early on, and that wasn't hard. So someone has already paved that way so that you don't have to do it in such a difficult manner. So, just finding mentors or things. So those would really be my 3 things. Don't accept no, be authentic in who you are and in your work, and then find mentors.
Well said. Thank you. It comes from a place of not only wisdom, but experience yourself.
It's very true. Yes.
Very
Yes.
good. Well, Dr. Pinder, thank you so much for this conversation.
You're super welcome.
It is an honor to not only be in the same time zone as you, but the same table.
Thank you.
Thank you. So we have a lot more of our conversation and things that we're learning and seeing in Dr. Pinder's office that you can check out on the UC Health website. Everyone, thanks so much for joining us for this podcast conversation with Dr. Leeya Pinder. I'm Meredith Stutz. We hope that you have a great day.